Hi, I'm Dr. George Marosan, a board-certified plastic surgeon, and if you are watching this, you've probably given serious thought to cosmetic plastic surgery. Hopefully, I can guide you through the decision process so you can make the right choices. First of all, whether you choose me or someone else to perform your surgery, there are several very important, even vital points I want you to think about. Choose a surgeon who is board certified by the American Board of Plastic Surgery, ABPS, established in 1937 and is one of the 24 boards that make up the American Board of Medical Specialties. To become board certified, one must take a vigorous written and oral examination and present selected surgical cases that you did in 1 year's time in your surgical practice. Anybody can call themselves a plastic or cosmetic surgeon. Oral surgeons, dentists, gynecologists, dermatologists, and even family practitioners, for example. Unfortunately, myself and my colleagues to see more and more poorly performed plastic surgical procedures performed by unqualified practitioners. Some surgical misadventures are simply not correctable. Key information is to find out if your plastic or cosmetic surgeon has hospital privileges for the same surgeries he or she is planning to perform in their office surgical suite. For example, a hospital will not credential an oral surgeon, even though he calls himself a cosmetic surgeon, to do a tummy tuck or breast augmentation in the hospital. Make sure that if your surgeon is planning to do your surgery in an office surgical suite, that this is accredited. This means that the facility has to abide by strict state and federal regulations to provide a safe surgical environment. You should request to see the accreditation certificate and be sure that it is up to date. Office surgical suites can be accredited by any of these agencies: Quadruple A SF, Medicare, AAA-HC, and JCAHO. Also make sure that your surgeon has hospital privileges. I am an active staff surgeon at Overlake Medical Center. Now, none of this is meant to scare you about surgery, but this homework must be done even before you meet the surgeon. Cosmetic surgery is very safe, rewarding, and effective if it is done by appropriately trained and experienced surgeons. After you are satisfied with the background check, you can set up your consultation. The consultation is not only for the surgeon to decide what he or she should do, but this is your chance for a face-to-face interview with the surgeon. Do not be embarrassed to ask your questions. Ask if the surgeon is a member of the American Society of Plastic Surgeons, ASPS, or the American Society for Aesthetic Plastic Surgery, ASAPS. The latter, of which I am a member as well, has its members dedicated to aesthetic surgery of the face, body, and breast. Of all the board-certified plastic surgeons in the United States, about 7,500, only 2,000 surgeons were admitted to ASAPS. Only surgeons board-certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada can belong to these societies. You should also ask, am I a good candidate for the procedure, and what are the possible alternatives? Who performs the procedure? What is the post-surgical recovery, and how much time I need off work? What are the risks and possible complications in my case? What do I need to do to optimize my results? This is the time you find out if your personalities match and if you can trust this person, literally, with your life. If your surgeon acts defensive or indirect in his or her answers, my best advice to you is to politely walk away. Although training and experience are essential at the core of any surgeon, your plastic surgeon must possess artistic skills as well. The plastic surgeon, just like a sculptor, has to think in 3 dimensions and have a vision of the surgical outcome. The best way to evaluate this is to look at the surgeon's before and after photos of previous patients who had similar procedures that you are contemplating. We do all our surgeries, face, body, and breast, in our accredited office surgical suite with anesthesia services provided by Puget Sound Anesthesia Group. I have been working with them since I started my practice. They make it possible for me to perform major cosmetic surgery procedures safely and in an outpatient setting, which in some parts of the country are strictly done in a hospital. We have one of the largest office surgical suites outside the hospital. This allows me to do major body contouring procedures comfortable and safely. In closing, let me tell you what my staff and I care about most. We care about safety and to deliver the best results possible. Whether we do your surgery or not, we care about you. You can always call us with your questions or concerns. During office hours, you will always be greeted by a person who is there to help you, and not by a machine with a recorded message to promote ourselves. A well-educated patient about plastic surgery with realistic expectations can make the right choices and enjoy their results for many years. We are here to make your surgical journey a pleasant one.